breathing in the balance, finding inner space. Wellness grows in quiet when you drop the race. Listen to your body, hear its gentle tone. You deserve the softness you can call your own. Laughter in your routine, kindness.
All right, it's another day on your program, your favorite program, that is Earth Corner on the Steam Radio Vision, located at Obokun Avenue, Ilesha, Osun State, Nigeria. And what we do on Earth Corner, we give ourselves information that will be of help to our health. That is what we do on Earth Corner. And today, we are here to give it to you another interesting topic, which has to do with our baby. And you know, the topic we've been treated for like 3 days ago now has to do with the baby child. And you know why? Because the way we know that the way we train our child, or how we treated our child, that is what they will bring for us, and that is exactly what they will look like. That is why we have to take their own matter serious. On Earth Corner today, I have a privilege even to be amidst of two professionals. What did I mean with the two professionals is that we have Nurse Nwoko Ezenimori Constant as our regular nurse on the program. And today, I have here with me, it is my honor, and let me say I have the privilege to introduce to you our clinical physiologist in our midst, in person of Miss Oluwatosin Ilore. And let me start from the regular nurse. Before then, let me quickly introduce myself. Oh, Adenipekun Afolabi is my name, and to my executive producer, a person of Deacon Michael Adeboye Ashala, and the man behind the console, that is Balogun Abdul Samad. We are saying you are welcome to Earth Corner today. All right, Nurse Nwoko Ezenimiri Constant. Good evening, ma.
Good evening, Mr. Falabi.
All right, thank you for joining us once again on today's episode of on Earth Corner.
Thank you so much.
All right. Let me the clinical physiologist in our midst.
Yes, sir. Good evening.
I want you to greet our people at home, those that are watching us.
Everybody. It's nice to welcome to Health Corner, and thank you, Mr. Falabi, for having me here always.
All right. Okay. Because of our time, what we want to talk about today, it has to do with the congenital heart defects. That is what we want to talk about, and we have the abbreviation for it. That is CHDS. That is the congenital heart defect. That is what we want to talk about. Now, you know, this particular topic that we want to treat today. Let me start from Nurse Nwoko Ezene.
No.
Are you there, ma?
No. Yes, please.
All right. Okay. I want to start from your own angle. I mean, from you there. We need more explanation, and we want to know meaning of this congenital heart defect, because when you talk of heart or you talk of defect, we understand that heart is one of the organs in our body, and when you talk about defect, it means maybe when that thing, our heart is not working the way it should be, and which we know that it is very dangerous. Can you expatiate more on this? What are the congenital heart defects?
All right. Thank you, Mr. Falabi, for having me on the show. Well, congenital heart defects can be described as those structural problems, those defects in the heart of a newborn baby. When I mean congenital, the word congenital means right from birth. It got it from the mother because of the what has gone wrong during the course of childbirth or development. So that's the word congenital. Then heart means the organ that pumps blood. Then defect means a deviation from normalcy. So those structural problems of the heart or even the blood vessels, the major blood vessels that a baby was born with, a defect in those structural blood vessels and heart muscles and cells is what is known as congenital heart defect. Any structural problem that is happening in them. So because we find out when a baby is getting ready to be born, when the baby is forming between the 3rd and 8th week of pregnancy, that's when the heart forms, and that is when this problem can start. Because we find out that if there's any abnormality within this range, within this 3rd to 8th weeks of life, this defect can come up. This congenital heart defect can come up, and it ranges from small holes to a severe abnormality in the heart chambers or the vessels. So it's really something to be watchful and be careful so that it doesn't really happen, because it's a very serious defect, just like the name implies, congenital heart defect. So any structural problem in the heart or the blood vessels of the heart, major vessels of the heart, is what is known as congenital heart defect, and it happens in utero, when the baby is still in the womb. So that when the baby is born, you see they start manifesting those signs and symptoms of structural abnormalities. Thank you.
All right. Thank you, Nurse Nwoko. Now, I want to ask this question. You said when you said the heart it forms. I mean, even before birth, and if the baby have the defect before birth, it will definitely affect the baby. What do you think that is the causes of baby for such a child like that to have such defects at that age?
All right, there are so many causes. There are so many things that can cause congenital heart defects. So we have things like genetic abnormality. The cause is not really known, but we have several factors. Do you understand? We don't know the exact cause, but there are so many risk factors or factors that can contribute to a congenital heart defect. Things like genetic abnormalities. That's what we call Down syndrome. From the name of the person that discovered it, is known as a syndrome that affects that causes a congenital heart defect. Another risk factor is family history of congenital heart defect. When a family has a history of congenital heart defect in previous children, the children of those family will also have the likelihood of having a baby that has congenital heart defect. Then maternal conditions such as diabetes. When a woman has diabetes, is a risk factor for the baby for her unborn baby to have congenital heart defect. Then there's also what we call rubella during pregnancy. If a woman is having rubella during pregnancy, it can affect the baby's heart. And give the baby congenital heart defect. Then any mother that is used to drinking alcohol, smoking, or anything, or cocaine, they can come down with congenital heart defect. Then some medications as well have been associated with congenital heart defect. Some medications like lithium and isotretinoin. Then another thing that can cause congenital heart defect is obesity or advanced maternal age. As a woman advances in age, that's why it's good we advise people to get married at a reasonable age, at least before 24, from 24 upwards, so that you have good eggs. Because if anything above 35 years old, the eggs of the woman might have the chances of having abnormalities that can manifest as congenital heart defect. So that is why maternal age is a risk factor for a baby coming down with congenital heart defect. Thank you.
Okay. Before I will move to the question I have on these factors that contribute to the congenital heart defect. Okay, let me quickly take this question from our clinical physiologist in our midst. Okay, I want to ask this: how common are congenital heart disease?
Well, CHDs, they are actually one of the most common type of birth defects globally, in sense that when we have 1,000 newborns, about 8 to 12 of them come out having any of these defects. So even in Nigeria, 1% of the newborns they have the congenital heart defect. But the good news is that there are now modern technologies, modern medications, diagnosis, and surgeries that can help any child that is born with heart defects to survive and have a healthy life. It's very common.
Okay, now let's look at it. Let's forget about the global now. Globally, not globally, but in Nigeria, how can you rate this heart defect, this congenital heart defect?
Like I said,
if you want to give it percentage, how will you rate it?
Like I said, it's a common heart defect. Like out of 100%, 1%. If you are looking for what's the causes of this defect, you see that what the child has is CHD. So basically, I don't work in maternity or gynecology, but I can tell you, maybe from my experience from doing children echo ECG monitoring, I can tell you that we have fetal echocardiography, fetal ultrasound almost like every day. Sure you get. And this, for a doctor to ask a mother to do a fetal echo, it has to do something is wrong with the heart. And by the time the result comes out, you find out maybe the child has a hole in the heart or there's a blockage of the vessels. So I can say it's something alarming, and the mothers, and as Nurse Nwoko said, it's something that the mothers, they need to work on. When you are pregnant, the heart forms between 3 to 8 weeks. So every mother, they need to take their medications, they need to be aware of their environment, because we don't actually know the main cause of these defects. All we know and all the facts that we have on ground are factors that contribute to it. So every mother, every pregnant expecting mothers have to be conscious of their environmental factors, their daily routine, to avoid these defects.
Okay, thank you, Miss Oluwatosin Lore, for beautiful response. Now back to Nurse Nwoko Ezene. You, during the course of your discussion, you talked about that the advanced maternal age. Now you said a woman should get married within the range of 24 to 30. Now, with the present situation that we find ourselves in a country that even the men are running away from their responsibility, let's assume that the woman are married late. Is that a way that that person can work toward? I mean, how is that a way that the person can work that it will not affect the baby when she later got married? With the situation that we find ourselves, is that a way?
Well, there are advances in technology right now, but it all depends on if you can afford them. So for a young lady that is maybe advancing in age, you have your money and you don't have a suitor, and age is no longer on your side. By that time you are still young, you can save your eggs. You can actually do egg collection and save your eggs, so that when you get married, you have, though it's going to be a sort of a mini IVF. Well, what I mean by IVF, in vitro fertilization, whereby you use your egg and germinate it with your husband's sperm. So the younger eggs, not the older eggs that are at the age you were. So such a thing can be done. So But I'm not saying that if you do not see, that is why some mothers will encourage their daughters. If you are getting older and you don't see a suitor, at least have a child. But I'm not trying to support promiscuity. But I think it's better to have a sound baby than to have a malformed baby, because this maternal factor, increase in age, has been associated with congenital heart defects. So, and it's not good that you have a child who will be a burden to you all throughout his life. It doesn't tell good. So, if a young lady can afford saving her eggs, while she was still young, she can do that. So that when anytime she feels like getting married, at least maybe she's looking for the best suitor, she's looking for the best suitor to choose from the best of all her suitors. It all depends on her, so she can use her eggs later in life. Is an advance in technology that it is not possible, so that you have as normal babies as you would have had when you are still in your 20s.
Yes.
You can have as normal babies as when you are still in your 40s, as that you can have normal babies that you're supposed to have when you're supposed to be in your 20s at the age of 40s and 50s, provided you save your eggs. So there's science has made it possible for us to have such an advantage, So it's a risk factor for you to keep quiet and start getting old and hoping that anytime you get married, you can have a normal child. Is not really the best. You're putting it. I'm not saying that you cannot have normal baby at old age, but it's a risk factor. When I say something is a risk factor, there's a higher risk for you to have a normal baby than for you to have a normal baby. Though people still have normal baby at old age, but that does not put the fact aside, especially if you have a family history of congenital heart defect. At older age, the tendency tends to be higher, the more. Thank you.
All right, let's look at the family history. You talked about the family history. Does that mean that if they have cases, maybe they have previous cases that, okay, one is having a congenital heart defect in the family, definitely can this be transferred or heredited by the other family member?
Thank you so much. Yes. What I mean by family history is, we talked about genetics from the first point, genetic abnormalities. It also runs in families. So when a family have a history of, just like a family having a history of hypertension, you find out that if a mother has a family history of hypertension, there's a tendency that the child, the son or the daughter will have it. So what I mean is, if a mother has delivered a child that has congenital heart defect, and the child grows up and was able to survive it and has his own children, there's a tendency that she herself or he herself would also have a baby that has congenital heart defect. So that's what I mean by it running in family. It runs in family. If it runs in family, there's a tendency that the progenitors of that family will have such congenital heart defects. That's what I mean.
Okay. All right. With this, are all heart defects the same? Are they the same?
Well, not really. We have groups. We have types. They are not all that. There are different categories.
Okay.
We have like up to three major groups. Some group them as 2, some group them as 3. We have what we call the acyanotic defects. These ones are like holes in the heart. When you have holes in the heart, then you have the ones that are obstructive. These ones are when you have obstruction, just like an obstruction. Then you have the cyanotic. These ones affect mostly the blood vessels, trying to lower the oxygen supply to the bodies, and the baby will look a little bit bluish. So we have, in a nutshell, about 3 of them. The cyanotic, where you have arterial septal defect, ventricular septal defect, and patent ductus arteriosus. I may be sounding, I don't want to be mentioning this name, but just have it, because we are talking to the lay people. Let's just say we have just 3 groups. 3 groups of 1, acyanotic, the ones that have to do with holes in the heart, the ones that have to do with obstructions in the heart, and the one that has to do with the vessels of the heart. Those are the three main classifications of this heart disease. Thank you.
Okay, thank you. Now, I want to ask this question from Miss Ilori Oluwatosin. Now, looking at this, the classic, the Nurse Nwoko mentioned about, about the three major groups that she talks about now. My question now is, what are the symptoms should parents watch out for if they want to really know that, okay, maybe their child is having the congenital heart defects?
Okay, thank you. For our parents and caregivers that are listening, I'd like to mention some symptoms or signs that you can look out for in a child that is are suspecting CHD. Number one, you can look out for a bluish lips or skin. That's a sign of cyanotic defects. That happens when the blood circulating the body does not have enough oxygen. Okay. Another thing you can look out for is the breathing sound. A pediatrician can check that with a stethoscope. The heart murmurs, even if you are at home with your child, you can check how the heart is. Is it beating fast? Is it normal? Or is the child having difficulty in breathing? Another thing is poor feeding, sweating while feeding. Not the sweating is not normal. It's not coming maybe because the food is hot. It's uncontrollable, so you should be suspicious. Something is wrong. Another thing you can look out for in babies is failure to gain weight. Maybe a 3-month-old child is supposed to have a particular kg, and you are suspecting that no, this child, the weight is not normal, so you can take it to the hospital for further tests to know. Another thing you can watch out for is repeated chest infections. So all these things, I'm not saying maybe if your child has infection now, that means the child has CHD. No, there are signs that when you see, you should go to the hospital and have further tests. Thank you, sir.
All right, thank you. Let me ask Nurse Nwoko this question. She made mention about he said when the baby is, for instance now, we all know that if baby is sucking, there is possibility of the baby to be sweating. Now, you talked about sweating while feeding. Should we now categorize this as part of the things that mothers should watch when they are feeding their baby, and their baby has, the baby is sweating, which we know that it is a normal thing? Are you not saying it is not normal? I'm asking that Nurse Nwoko now.
All right. Just like my clinical physiologist said, well, why you are feeding your baby, there's what if a food is not hot, there's no cause for the baby to start sweating profusely. And when I mean not just normal sweating, not just mild sweating, but profuse sweating, and he said, and at the same time the feeding is poor, he's not feeding very well, and at the same time he's sweating, is a cause for alarm, is an indication for you to know that something is going on wrong, something is wrong somewhere, and if care is not taken, the baby might even choke on the food and all that. So you want to check out, why is this baby sweating? He's not even feeding very well and he's sweating. Why is he sweating? You need to take your child to a clinic or a well-established health center or hospital so that they can find out what is going on. Just like we said, that it could be that you get there, it may not be something serious to worry about, but at the same time, it's a sign, it's a pointer that something is going on. So you might also get there and you find out that something actually is going on, and you'll be able to kind of arrest it on time. Because most times, these babies, after delivering them, they may not show those signs immediately. They may start showing them as they are growing up. So it falls within the court of the mother to find out, to be able to discover all these signs and symptoms she mentioned, like this bluish lips and skin. If it's a mother that is not very observant, you might think the baby is maybe she's getting dark, or she might just casually overlook it. But as we have mentioning it in this health corner talk today, any mother that notices such things, all these things that she mentioned, bluish leaves, fast or difficult breathing, poor feeding and sweating, failure to gain weight, and repeated chest infections, all these things are pointers that something is going on in the baby's heart. So the mother should quickly rush the baby to a health center, a hospital, or any place that he or she can get adequate treatment, adequate examination, laboratory examination, or echocardiography, or what have you, that facilities that can provide structured, intensive, and well structured examination for the baby, where you have good doctors, good pediatricians, good nurses and doctors that can take care of the baby. It is a pointer, just like every other one. That poor feeding and sweating is a pointer to the fact that something is going on in the heart. Thank you.
All right. Thank you, Nurse Nwoko. Now, once doctor suspects a heart defect, how is it confirmed?
All right, like I mentioned before, there's what we call echocardiography. That's a kind of ultrasound scan that will show you the heart structure. It will show the heart structure. It will show if there's a defect. It will show if there's a hole. It will show if there's an obstruction. It will show anything possible that is going on in that heart. That's called echocardiography. That's using a kind of ultrasound to check the heart from the outside. Just is a kind of you apply a gel and use a kind of, is the sonographers that does it, and you use your gel to kind of place on the heart and use a probe to kind of go around and find out if something is going on or not. It will just show the heart structure on a screen as you are doing that. So another thing that you can use to confirm or detect any structural abnormality in the heart is what we call the ECG. ECG is known as electrocardiogram. It will check the heart reading. So whatever the heart reading is telling you can be a pointer also to confirm what is going on and the echocardiography. So then another thing is chest X-ray. If you do a chest X-ray, it can show the heart. It will show the structure of the heart. It can show any major problem, especially coarctation of the aorta and all the rest of them. Then also, pulse oximeter will help you know the baby's saturation. Normally, we say that from 92 to 100 is a normal saturation for a baby. So anything below 92, some authors will say 94, some will say 92. So anything between 94 to 92, oxygen saturation, if you see such a thing, is an indication that something is going on. Then advanced imaging like CT or MRI. CT is computed tomography, or MRI, magnetic resonance imaging. Yeah. Any of these two can also be used to find out what is going on in the heart. Then there's also what we call cardiac characterization. This one is for detailed assessment and also for treatment. So we can also use fetal echocardiography around the age of 18 to 22 weeks of pregnancy to detect it inside the womb. So while the woman is pregnant, this echocardiography can detect it inside the womb, so that when the baby comes out immediately, if it is something that can be done, if it's a surgery that can be done as early as the child was born, it can be done. If it is something that has to be delayed until the child gains weight, so that he or she can survive the surgery, it will be kind of delayed. But at the same time, both the mother and the health practitioners will know that this baby is a special baby that needs special care. So all these things I mentioned, the echocardiography, the ECG, chest X-ray, pulse oximeter, CT scan, MRI, and cardiac catheterization are all that you can use to diagnose or find out if a baby has congenital heart defects. Thank you.
All right. Thank you, Nurse Nwoko. Now back to uh, Miss Ilori. I want us to look at the how to manage this congenital heart disease that we are talking about. Now, how are these heart defects managed?
Okay. Talking about the treatment and the management of CHD, it actually depends on how severe the heart defect is. We can use medications, you can use medical treatment if it is not very severe. We can use medication like diuretics, and so on to control the systems. And some babies might need prostaglandin infusion to keep the blood vessels open until the surgery. Another treatment that can be used is catheter-based intervention. This one can be used maybe there's an issue, there's a defect in the atria or the ventricle, there's an atrial septal defect or ventricular septal defect. You can add a device. It's going to be a small, or let me say minimal invasive surgery, whereby you add a device to the heart to help the heart to perform the functions very well, the circulating of the blood very well. Another treatment option is surgical repair. This one is usually done when the heart defect is very severe and medication didn't work or the medication stopped working. You can have a open heart surgery and arterial switch. In fact, you can even have the entire heart transplant. So after the heart transplant, once you have done the treatment, the child with the CHD can go on living their normal lives. They just need to go back to the hospitals for their medical checkup. A child that has undergone a surgical repair or that was given a device that is supporting the heart, you have to constantly go back to the hospital for medical checkups. For now, those are the treatments that I know that are available and they are working perfectly well.
Okay, let me ask you this. What what is the chances of the heart? You talked about that maybe heart transplanting. What are the chances?
Chances of heart transplants. I think in Nigeria now they are doing heart transplants. Anyways, I'm not a cardiologist and I'm not a cardiac surgeon, but I believe there are some hospitals in Nigeria where you can do heart transplants, and there are a lot of factors that determine the success of a heart transplants.
What are the
One,
factors?
one we can say is the donor, the quality of the heart. Like you have to have a good heart to be transplanted. And another thing is if the patient does not have any other underlying disease, if they don't have maybe diabetics or any other thing that can cause trouble, because some people self will have a successful heart transplant and at the end of the day when they die or something happens, it's due to another disease entirely. But I believe in Nigeria we are coming up and we have beautiful surgeons, very good cardiac technicians that are helping, and I believe that the success rate of cardiac surgery heart transplant in Nigeria is quite okay.
Okay, with this, how many hearts can we find in a woman, in human being? How many
Every
hearts?
human has just one heart.
One heart.
Yes, the
But
heart is divided into four chambers. That's the left atrium, right atrium, left ventricular, right ventricular, and then we have the valves in between. But every human has just one heart.
one heart. Now, how will it be possible for heart transplanting? It means someone that want to give his heart, we have to leave this word for the
Yes.
person that you want to give heart to. How
Yes,
is it
we
possible?
have people that there are some people that are brain dead. There are some people that maybe they have um a kind of you know disease going on that they maybe most especially I think cancer patients that the cancer is really, really advanced and they have very short
Time.
yes to live. So some of them, they do voluntary donation. They donate to anybody that needs heart transplants. There are some
Just
people
like
that are
that.
old. Yeah, now there are some people that are old that just gave up in the hospital, like maybe, great grandmothers, great grandfathers, and they will donate their heart. They will tell you, oh, when I die, remove my heart, keep it, you can donate it to someone.
Okay, what you are saying is this heart can be taken after when someone is already died.
Once the heart stops beating, you cannot make use of it. Any heart, they have to take out the heart before the person dies.
Definitely the person will be alive. Why they will operate
Yes, but the
heart?
person has already signed that it's a voluntary donation. You are not just killing the person because you want to remove the heart. The person is dying due to another disease or another
Because
reason.
this is not kidney or liver.
The person is dying due to another reason, and the person has decided, he has signed some legal times that he wants to donate his or her heart to this particular person. So they take, when they do the surgery, they don't do the surgery like, they don't butcher them. They don't do it like, maybe, oh, this person will die now, let's just do this. They do it like, oh, this person is still, the way we treat cadavers, medical people, the way we treat them like humans. We don't just, because when I was in school and we were working on cadavers are dead bodies. When we treat them very well. You don't just, oh, this person is lifeless. No.
You treat them as if they are still alive.
Like humans. Yes. You treat them like eggs. You take care of them. So because they are the reasons why we are able to, we are able to learn a lot. They are the reason why we are able to go this far.
Oh, yeah. With the information I got now, it means it will be difficult. If I'm not wrong, it will be difficult for you to see someone who will voluntarily donate his heart for you to be alive. That is why you have to take good care of yourself. You need to take good care of yourself, especially your heart, because once the heart stop, palpitate or pumping, definitely it means the person is gone. Oh, all right. Let me throw this question to Nurse Nwoko. What complication can occur if these CHD are not untreated? When they are untreated.
All right, thank you, Mr. Folabi. There are a lot of complications that may arise as a result of complications from untreated CHD. First, you have things like heart failure. The heart will fail because in the course of trying to pump against the pressures that it's experiencing, it might fail, just like a car can break down because of too much pressure, because there's a lot of pressure on the heart and it's not being relieved, it can fail. Then there is what we call pulmonary hypertension. You can have a sort of hypertension in that small child, Then you can have stroke. The baby can be part of the body can be paralyzed. You can have, what we call heart rhythm disorders. When they check the ECG of the baby, you might be having what we have ventricular tachycardia. Let me not just mention terminologies. You can have a rhythm that is in disorder, that is not in cognizance with the baby's age. You find out that you can look at the heart rhythm, like is this a baby's heart rhythm? Those are the complications. Then you have what we call endocarditis. That's inflammation of the inside of the heart. The inside of the heart might start having start having inflammation and infection. Then in severe cases, you have what we call sudden death, because the heart is actually the mainstay of life. It is what pumps blood to every part of the body. If it fails, it means death is the next thing that will follow. So in severe cases, what you have is sudden death, and the baby will just collapse and die, and which is not what we want to have. So those are the complications that will arise if it is untreated. So
Okay.
they are all pointing to, okay.
All right. Thank you for that beautiful response. Now back to the Miss Oluwatosin Ilore. Now, yeah, I want to ask this question: can a child with CHD grow up to live normal life?
Okay. Yes, the answer to that is yes, absolutely yes. A child with congenital heart disease or defects can grow up to live a normal life. Once the heart defect is detected early and they follow the necessary medical procedures, medications, and even if it is surgery, they do the surgery on time, the child can live a normal life. They can go to school, they can live a productive life, they can even do sports. So far they are doing their, you know, regular medical checkup. Yes, they can live a normal life.
They can live normal life. Okay, back to Nurse Nwoko Ezene now. What step can expectant mother take to reduce the risk of congenital heart disease? I mean defects.
All right, thank you, Mr. Falabi. For every pregnant mother, just like I always say, it starts with antenatal. Once you confirm that you're pregnant, make sure you go to the hospital and book for antenatal. Both your lectures, your drugs, your tests will reveal whatever that is going on and take care of whatever that is going on. So just this, if you, a baby have, just like I mentioned earlier on, that between 18 to 22 weeks, an echocardiography can detect a heart disease. So if it detects it at that early age, you prepare your mind, prepare the mind of the mother, you prepare them financially, prepare them psychologically, because all these things entails financial involvement. So when they are financially prepared, any surgery that is ready to be done, they can comfortably prepare for it and let it be done. Then another thing is, if a mother has any complications such as diabetes during pregnancy, they should make sure they are taking their drugs, because diabetes is also a contributing factor, a risk factor. Like we said, we don't know the exact causes of this CDH, but there are some contributing factors. There are risk factors, which diabetes is one of them. Then if a mother is fond of drinking alcohol or smoking, she should quit, because she's endangering the baby's heart. She's endangering the baby to exposing the baby to congenital heart defects. Then, if a mother is pregnant, there's a vaccine for rubella, which is one of the causes of congenital heart defects. She should go for that vaccination before pregnancy, before even getting pregnant. Then there's another thing they should do. If they are fond of going for over-the-counter medications, they should stop it. They should avoid taking medication that are not prescribed for them. Then there's one beautiful medication that pregnant mother will give pregnant mothers. Every pregnant mother, we call it folic acid. It's a small but mighty medication. It
Small
takes
but
care of
mighty.
most. Yes, it's a very tiny medication like that, but it takes care of all these congenital deformities. It helps, especially when you start taking it early in pregnancy. It helps to make sure that the baby does not come down with some of these defects, especially the neural tubes and the heart defects. Then another thing is also seeking genetic counseling if there is a family history. Let's assume you know that your mother had it, when the mother had a baby, she had a congenital heart defect. You're about to have your own family now. You have to go for counseling, because there's some of these heart defects. There are some you can have that you notice it on time. You go for counseling, genetic counseling. You'll be told whether to terminate the pregnancy or to continue with the pregnancy, if you can afford to take care of what is going to come out of the pregnancy and all that. So these are the things you get out of genetic counseling. So those are the things you will do to do what? To reduce the risk of having a baby that has congenital heart defects. Thank you.
All right. Thank you, Nurse Nwoko Ezene, for that. Let me put it to Miss Oluwatosin Ilore, the clinical physiologist in our midst now. What advice do you have for the mother, the pregnant woman, especially the one who think that going to the clinical checkup is just a wasting of time. What advice do you have for them as they are watching us right now?
For every expectant mothers, every pregnant woman, I would advise you to take your antenatal serious. Take every word of the nurses, of the midwives. Take their words serious. Take care of yourself, not just for yourself but also for your baby. You know, if you think giving birth to a deformed child is something nice, then obviously you are doing more harm to the baby than yourself. It's the child that will live with that deformity for the rest of their lives. They, you know, you don't. Disability is not something they
Something
want
that someone
to.
can proud
Yes,
of.
yes. And the children, most of them, they will end up hating themselves, hating their mothers, and you know all these things can be prevented. All these things, if you tackle it now, if you take your medications on time, you avoid smoking, taking hard drugs, you avoid these things, you have your healthy baby, unless maybe it's genetical, which we know that the prevention is almost impossible if it's genetics. But at the same time, if you prepare yourself financially, even if anything happens, you'll be able to take the necessary medications and the necessary steps and still have your healthy baby. So please take care of yourself, take your antenatal serious, take your doctors, your nurses, your midwives advice serious, and avoid self-medications. When you are pregnant, you should not self-medicate. There are some drugs that, you know, that enable some of these defects. You don't know. You have headache, you have this, you go to the chemist, you get drugs, but you're harming your baby. So if there's anything wrong to you, go to the hospitals. Take medications only from your doctors. So that's all I'll be saying. Take your folic acid supplement
That
very
is
serious.
small but mighty medication that Nurse Nwoko
Yes.
mentioned.
Yes,
Okay,
thank you.
Nurse Nwoko, your final take on today's edition of our program today. Your final take.
Right. Thank you, Mr. Falabi. My final take to our listeners is nothing but, just like I'll continue to say, hammer it on time. Please make sure you attend a well-established hospitals. Well-established hospitals. Even if you are in the rural areas, our community health centers are well established. So that if you go there, if they don't have the facilities you are looking for, if they don't have the equipment that is suitable for you, they can refer you to tertiary institution, because it's a chain of transfer from primary to tertiary, from primary to secondary, from secondary to tertiary. So every primary health center has a way of handling their cases. If it is something they cannot handle, they will refer you to a place you can be taken good care of. So please stop at patronizing quacks. All these things we are discussing today, if you go to a quack, if you go to traditional birth attendant to go and deliver your baby, he or she may not be able to dictate all these things. And not until something happens, or death or something, that is when your eyes will not open. You will not like, had it been I know. So to avoid had it been I know, please make sure you attend a well-established, a well-equipped hospital. Even if you're in the community settings, go to community health centers. If they cannot handle your case, they will send you to a secondary health institution. If the secondary health institution cannot manage you, they will take you to a tertiary health institution, which is a teaching hospital. So please, please stop patronizing quacks. Then I want us to take home with this congenital heart defect is that they are very serious. They are very serious cases. But if you dictate them very early in life and take good care of those children, they can live a healthy life. They can live good lives. They can live a normal life. They can even go into sports, provided they are doing what they're supposed to do. Or maybe if like somebody like Kano Wankwo has a pacemaker in his heart, but he's playing football.
And he play
Because
football
why? He's taking care of
for the
himself.
country.
Yes.
Yes, for the country, yes. So those are the things. So if you manage yourself very well, you can still do what others are doing. It's not a death sentence. So please, it's all the onion lies on our mothers to take good care of themselves and the babies, and be able to take the advice of their midwives and nurses and doctors, so that at the end of the day, you have a healthy baby, a healthy mother, and a healthy nation. Thank you.
All right. Thank you, Nurse Nwoko Ezenemeri Constant, for your time. We thank you for giving us out of your busy schedule. We know that even where you are shows that you are somehow busy. Thank you so much for sparing us out of your time. And to our clinical physiologist that we have grace and opportunity to have in our midst today on the program on the Health Corner, in person of Miss Ilori Oluwatosin. Thank you so much for coming.
Thank you, sir. Thank you, Mr. Afolabi.
We believe that when next time we call upon you, will definitely be here.
No problem, sir.
All right. Okay. Thank you for your time too, and many thanks to all our viewers. Thank you so much for staying with us till the end of today's episode of your program, Health Corner, and many thanks to the Chief Executive Officer and the Chief Producer, who is the brain behind this program, a person of Deacon Michael Adeboye Ashaolu, popularly called Omo Yalakara, and to the man behind the console, Balogun Abisamad. I really appreciate you, your patience. Thank you so much for giving us this quality that we are experiencing now. Thank you so much. And to all the esteemed staff, I say thank you for your contribution. And my name is Adenipekun Afolabi, your host for today. Don't forget that this congenital heart defect that we are talking about, it is very dangerous, but if you take good care of it, you can live a normal life. I'm trying to quote both Nurse Nwoko Ezene and the clinical physiologist in our midst, Miss Ilori Oluwatosin. And till tomorrow that we will meet again on the program, I'm saying to you, have a healthy and wonderful day. Bye for now.
Bye.